Welcome to the deep dive. Today we're diving into something many assume is just a teenage problem, but it's a real thing for many adults, especially women.
That's right. Postadolescent acne.
Exactly. Acne that shows up or sticks around when you're 25 or older. A listener actually sent over some great info from Up to Date on this.
Oh, excellent. Up to Date is a solid resource.
Yeah, so we thought we'd really unpack it, look at what makes this type of acne unique in women.
Good plan. So, the mission today.
Basically, understand how common it is, what might be causing it, and what you need to keep in mind if you're dealing with it.
Sounds good. It definitely deserves a closer look. It's actually surprisingly common.
Right. And this first big thing that jumps out from the source is the gender difference.
Absolutely. It hits women way more often than men once you get past adolescence.
Can you give us some specifics on that?
Sure. So there was this big study in China, looked at tons of people, over 17,000.
Wow.
Yeah. And they found before age 30, it was more common in men. But after 30, it flipped, more women affected. And then there's a UK study focusing just on adults over 25. It found clinically significant acne, like noticeable acne, in 12% of women.
12%. Okay.
But only 3% of men.
Big difference.
Huge. It really shows this isn't just a minor thing for women. It's a, well, pretty common health issue.
And it seems women are also the ones more likely to actually go see a doctor about it.
That's what the data suggests.
Yeah.
That same UK source looking back at referrals to dermatology for acne,
Yeah.
among patients over 25, three-quarters, 75% were women.
Okay, so it's common.
Yeah.
And women are actively trying to treat it. Does it just stick around forever then for women?
Well, that's the interesting part. While it's more common in women initially, it does tend to get better with age.
Okay.
There was a large study, US, England, Italy, Japan, looked at almost 3,000 women, ages 10 to 70.
Right.
Peak prevalence was around age 16, nearly 70%. But then in their 20s, it was still about half of women with clinically significant acne.
Half. It's still pretty high.
Definitely. Clinically significant, meaning more than 4 pimples or comedones on one side of the face.
Gotcha.
Then it drops. About a quarter of women in their 30s, maybe just over 10% in their 40s.
Okay, so it does trail off.
Yeah. And by the time women are 51 or older, it's less than 5%. So there's hope. It generally improves over time.
That's good to know. So let's talk about why it happens. Are the basic skin mechanisms the same as teenage acne?
Fundamentally, yes. You still got the same core issues. Too much oil or sebum.
Right.
Skin cells lining the pores not shedding properly, which causes blockages. Comedones, blackheads and whiteheads, and then
Right.
those can rupture, and you get inflammation, partly thanks to that bacteria, Cutibacterium acnes, feeding on the oil.
Okay, so the usual suspects. But what makes it different or maybe worse for adult women?
Well, several things might play a bigger role. Hormones are a key player, especially androgens.
Androgens. Often thought of as male hormones, but women have them too.
Exactly, and they stimulate those oil glands. We know this because treatments that block androgens often help clear up acne in women.
Makes sense.
Things like PCOS, polycystic ovary syndrome, are a common reason for high androgen levels. Less common causes exist too, like certain adrenal issues or tumors.
Okay.
And even some types of progestin-only birth control might contribute if the progestin is more androgenic.
Hormones. Hormones. It always comes back to hormones, doesn't it?
Often, yeah. But here's a really interesting point from the source material.
What's that?
Most adult women with acne actually have normal androgen levels when tested.
Wait, really? So if their hormone levels are normal, why the acne then? Is it just how their skin reacts?
That's the million-dollar question, really. One theory is that even with normal circulating levels, maybe there's more conversion of inactive androgen precursors into active androgens right there in the oil glands.
Locally.
Exactly. Or the glands themselves might just be hypersensitive. They react more strongly to the androgens that are present, even if the level isn't technically high.
Okay, so the skin's just more touchy, I guess. That makes sense.
Yeah.
What else? Periods often seem to trigger breakouts for many women.
Definitely. A huge percentage, up to 83%, report premenstrual flares.
83%.
Yeah. One study actually tracked it and found about a 25% increase in inflammatory spots right before the period in over 60% of the women.
Wow. Any idea why?
The exact mechanism isn't totally pinned down, but one idea is that the opening of the pore, the pilospacious orifice,
The pore opening, got it.
it might get slightly smaller just before the period, so sebum builds up because it can't get out as easily, like a temporary traffic jam.
Huh. Okay, traffic jam in the pore. What about things like smoking? does that play a role?
Well, some studies have linked smoking to adult female acne. One specifically pointed towards non-inflammatory lesions, like blackheads and whiteheads.
How?
The theories involve nicotine potentially affecting oil production or maybe how skin cells turn over that keratinization process again. But it's important to say the research isn't unanimous. Some studies find a link, others don't. So whether smoking directly causes it, well, the jury's still out.
Right, more research needed.
Mhm.
What about makeup and skincare? Could our products be betraying us?
It's definitely something to consider. There's acne cosmetica, acne linked to cosmetics, and pomade acne from hair
It's
products.
pomade acne, okay.
The idea is some ingredients can plug up those follicles, leading to comedones and then inflammation. Or sometimes products can just irritate the skin and cause a quick flare-up of little red bumps that's actually a type of folliculitis.
So should we all just throw out our makeup bags?
Haha, probably not necessary.
Right.
But it is tricky. How products are tested for being comedogenic, pore clogging, varies a lot.
Right.
And even if an ingredient can be comedogenic, it doesn't mean it will cause problems for everyone. Skin reactions are very individual.
So cosmetics might contribute sometimes,
Mm,
but it's not a definite cause for everyone.
exactly. It's hard to say definitively how much of a role they play overall for adult women.
Okay. The source also touched on other general acne factors: stress, diet, genetics.
Yes, and there was one specific case control study mentioned. It found some interesting associations in adult women with acne.
Like what?
Things like having had acne as a teen, a family history of it, never having been pregnant, having hirsutism, that male pattern hair growth,
Mm-hmm.
working in an office, high stress levels, and also a diet low in fruits, veggies, and fish.
That's quite a list.
It is, but even the researchers said, look, this is suggestive, but we need more specific research on post-adolescent women to really confirm these links. The evidence is still kind of building.
Got it. So a lot of potential contributing factors. Now, what does this acne actually look like on adult women? Any typical patterns?
Well, first, how it starts is interesting. For most women, it's actually just a continuation of acne they had as teenagers. That's called persistent acne.
Okay, so it never really went away.
Right, that's the most common scenario. Less common is late onset acne, where it pops up for the first time after age 25.
How much less common?
Studies suggest maybe only 10% to 18% of cases are truly late onset. So for most, it's been a longer journey.
Understood. And the spots themselves, same old blackheads, whiteheads, red bumps.
Pretty much, yes. It's usually a mix, those non-inflammatory comedones and inflammatory things like papules, pustules, sometimes deeper nodules. It's less usual to have just one type of spot.
And where does it usually show up?
The face is common, of course, but the neck and trunk, chest, back are also involved pretty often. One study found about half the women had acne on their body, too.
Huh. I always hear about adult women getting it mainly on the lower face, like the chin and jawline. Is that true?
That's definitely a pattern that gets described, sometimes contrasting it with maybe more comedones on the upper face, but
Right.
the data doesn't fully back it up as the defining feature. One study found only about 11% of women had acne just on the lower face. So yes, it happens there, but it's often more widespread than just the jawline.
Ah, okay. Another myth slightly busted.
Hmm.
And is it usually severe? Like
Mm.
really bad teenage acne can be?
Generally, no. It tends to be more in the mild to moderate range. Often, when a doctor sees someone, they might only have a few active spots at that particular moment.
Okay, that's a bit reassuring. So if someone suspects they have this, how does a doctor figure it out and rule out other things?
Well, the main diagnosis comes from looking at the skin, seeing those characteristic comedones or inflammatory lesions
It's physical exam.
primarily. But a really crucial part of the assessment is checking for signs of underlying high androgen levels, hyperandrogenism.
Right, because that could be driving it. What signs are they looking for?
Things like hirsutism, that male pattern hair growth we mentioned.
On the face, chest, back.
Exactly. Also, hair loss at the temples, like male pattern thinning. Other signs of virilization, like an enlarged clitoris, though that's rarer.
Okay.
Also, irregular periods, infertility issues, finding polycystic ovaries on an ultrasound. And other clues can be sudden, severe acne onset, acne that just won't respond to standard treatments, or physical signs like Cushingoid features, acanthosis nigricans, those dark, velvety skin patches, and obesity.
Wow, okay. Lots to look out for. And the source mentioned asking about hair removal is important.
Very important, because if someone is regularly waxing or shaving facial hair, it can hide the hirsutism.
Ah, good point.
So the doctor needs to specifically ask, do you have unwanted hair growth? how do you manage it?
Makes sense.
And another practical tip. If blood tests for hormones are needed, patients usually need to stop taking birth control pills for about 4 to 6 weeks beforehand,
Why is that?
because the pills themselves contain hormones and can mess with the test results, make them inaccurate.
Got it. Okay, so besides ruling out hormonal issues, what other skin conditions might look like acne?
Oh yeah, there's a whole list of lookalikes. Rosacea is a common one, redness, bumps, but usually no blackheads, typically on the central face. Perioral dermatitis, little bumps around the mouth, but it usually spares the skin right next to the lips.
Right.
Pseudofolliculitis barbae, basically ingrown hairs, common with shaving, can happen in women too. Then there's skin picking.
Where the damage is worse than the actual acne.
Exactly, acne excoriae. Also, drug-induced acne from things like steroids, lithium, certain cancer drugs, those progestin-only contraceptives again, bacterial folliculitis, eosinophilic folliculitis, acne mechanica from friction like helmet straps, even rarer things like lupus miliaris disseminata fasciae.
Okay, that's quite the list. Definitely highlights why seeing a professional is key. So once
Yeah.
it is diagnosed as postadolescent acne, what's the approach to treatment?
Well, first off, treatment isn't strictly required medically, but it can make a huge difference to how someone feels, their confidence, quality of life.
Sure.
So the assessment involves looking at the type of spots, how bad it is, any leftover marks like pigmentation or scars,
Right, the after effects.
and identifying any treatable causes like hyperandrogenism or maybe a medication that could be switched.
And then treating the active spots. Is it different than for teens?
The basic tools are similar. Topical stuff like retinoids, azelaic acid, salicylic acid, maybe topical antibiotics, oral isotretinoin for severe cases.
The usual acne treatments.
Right. But for women, hormonal therapy is a really important option. And interestingly, it can work even if tests show normal androgen levels.
Back to that sensitivity idea.
Exactly. So things like certain birth control pills, especially those with anti-androgenic progestins or a medication called spironolactone, can be very effective.
Okay. What if someone's already tried a bunch of things that didn't work?
That's super common. So getting a detailed history of past treatments is vital. Did it really not work, or was it maybe not used long enough or consistently enough?
Good point. How long do treatments usually take?
You generally need to give most acne treatments a good 8 to 12 weeks of consistent use before you can really judge if they're effective or not. Patience is key.
8 to 12 weeks.
Okay.
And obviously for women, pregnancy is a big consideration.
Huge. Absolutely essential. Many standard acne treatments, especially retinoids, topical and oral, and spironolactone, are definite no-goes during pregnancy.
Right.
So doctors must ask about current pregnancy status, plans for the future, and discuss contraception if needed when prescribing these meds. Safety first.
Absolutely. And you mentioned treating the after effects, the marks and scars.
Yes, because those can be just as distressing, sometimes more so, than the active acne. Post-inflammatory hyperpigmentation, those dark spots and scarring often need specific treatments, like different topicals, chemical peels, lasers, microneedling.
Okay, so there are options for those too. What about just basic skincare? Any tips?
Definitely. Gentle is the way to go. Absolutely no picking or squeezing that just makes inflammation and scarring worse.
Hands off.
Exactly. Use a gentle cleanser, avoid harsh scrubs. And because treatments can be drying, a good non-comedogenic moisturizer daily is really helpful. Keeps the skin barrier happy.
Non-comedogenic meaning won't clog pores.
Right. And daily sunscreen, always. Helps prevent those dark marks from getting darker.
Good advice. What about makeup?
Look for non-comedogenic or non-acnogenic labels. Oil-free liquid foundations, especially silicone-based ones, might be better tolerated than heavy creams.
Okay, helpful tips. So looking long-term, what's the prognosis? Does it eventually just go away?
The data shows prevalence decreases with age, so yes, for many women, it likely resolves spontaneously over time. That's the good news. But it can hang around for a long time first. One survey suggested the average duration for women with adult acne was around 20 years.
20 years, wow.
Yeah, so while it probably will end eventually, managing it effectively in the meantime is important. And pregnancy, it's a mixed bag. Some women get better, some worse, some stay the same. It's unpredictable.
So an end is likely in sight for most, but it might be a marathon, not a sprint.
That's a good way to put it.
Well, this has been incredibly informative. So just to quickly recap for everyone listening, postadolescent acne in women is common, more so than in men, often a continuation of teenage acne. Hormones and skin sensitivity seem key, even with normal hormone levels. Diagnosis involves checking for underlying issues and ruling out lookalikes.
Right.
And treatment involves standard therapies, plus hormonal options, good skincare, and addressing any lasting marks or scars.
You've got it. And the main message for you, the listener, is really, if this is you, you're definitely not alone, and there are effective ways to manage it.
Absolutely. Which leads to a final thought to leave you with. Considering how much this impacts quality of life and all these complex factors, hormones, genetics, lifestyle, what's next, what kind of research or maybe more personalized treatments could really make the biggest difference for women dealing with post-adolescent acne down the road?
That's the big question. Definitely food for thought.
Something to ponder, maybe discuss with your dermatologist. Thanks so much for joining us for this deep dive.